I'm Dr. Joe Norris of McLean County Orthopedics in Bloomington. Patients often present to an orthopedic surgeon's office with long-term chronic shoulder pain and known rotator cuff tendon pathology. In our world, we call this rotator cuff arthropathy, but in simple terms, it's arthritis of the ball and socket joint with an associated rotator cuff tendon tear. Over the last decade, we've found a better solution to treat rotator cuff arthropathy, or arthritis of the glenohumeral or shoulder joint with associated rotator cuff tendon tears. It involves replacement of the shoulder joint in a very specific way. Instead of placing a ball where there was previously a ball of the ball and socket, and a socket where there was previously a socket, as a conventional total shoulder replacement would be, we reverse those components. We replace the socket with a ball and the ball with a socket. It makes for a very interesting looking x-ray, but more importantly, a very functional limb for someone that maybe was unable to use their limb prior to surgery. The idea behind reverse total shoulder replacement is to create an environment where the larger deltoid muscle can take over for the absent or torn rotator cuff tendons. This can take a patient who had previously extreme amounts of pain and an inability to lift their hand, maybe even over shoulder level, and have that patient be essentially pain-free with functional motion of their hand above the horizon or above their eye level. It's truly revolutionary in how we can treat patients with this problem. The process of a reverse total shoulder replacement is not as complex as you would think. It's often a one-night overnight stay in the hospital after performing the shoulder replacement. The patient does have some rehabilitation or physical therapy to do following the surgery, but often by 8 to 10 weeks, patients are back to life with less pain and better function. This revolutionary procedure of a reverse total shoulder replacement has previously only been performed at tertiary referral centers or academic institutions. However, our community is lucky enough to have this surgery offered right here in Bloomington Normal at Advocate BroMenn Medical Center, where we perform this surgery routinely.